Hello, my name is Howard Morrison, and I'd like to welcome you to the PDG B5 TA Center webinar on strategies for collecting and providing data on a mixed delivery system to support family choice. We'll get started here in a few minutes. All right, next slide, please. So welcome to today's webinar. Before we get started, there are a couple of housekeeping items to review. First, if you haven't already done so, please change your name on Zoom to show your first and last name and identify the state you are from. It's always nice to see who's here and how we can create networking opportunities going forward. Also, please keep yourself on mute unless you're asking a question, which we'll allow at the end of the presentations. Our first speaker today is Mandy Reeve. Mandy is a senior education researcher and technical assistant specialist in SRI education and specializes in managing, planning, and coordinating state system level policy and program initiatives and serving as a liaison between community stakeholders, state leadership, and research partners. She has been providing technical assistance to PDG B5 states for the last year and a half and has been working in state early childhood care and education systems for 10 years. Mandy, I'll turn it over to you.
All right, thanks, Howard. Thanks everyone for joining us today. I'm going to ask Howard to put a link in the chat to the PDG B5 TA Center brief that is similar to the content that we're going to provide today in the webinar. So it's an extra resource for everyone to have as they think about the content that we're going to share today. So I think obviously, it's important to start out with a definition. So make sure we all know what we're talking about. We all are on the same page when it comes to what we're going to be sharing today. And so we hope that throughout the day today, or throughout our hour, probably a little less than an hour, we describe how to define a mixed delivery system and family choice and how they are related. We're going to demonstrate why family choice is important, describe how to collect important data to increase family choice, and demonstrate how an example of providing families with that data. So we hope that by the end of our hour together, you are able to have gained new knowledge on these ideas. What we mean by mixed delivery. So ESSA, or Every Student Succeeds Act, provides us with a simple and basic definition of mixed delivery. A mixed delivery system is a system of early childhood care and education services that are delivered through a combination of programs, providers, and settings. This includes Head Start, licensed family and center-based childcare, public schools, and community-based organizations, and is supported through a combination of public and private funds. So you can see the big highlights are delivered through a combination and supported by a combination of funds. So this is what we mean when we talk about mixed delivery systems of early childhood care and education. The Preschool Development Grant, PDG B5, provides states with a unique opportunity to improve their comprehensive early childhood care and education system and enhance their ability to implement mixed delivery. PDG states are building, enhancing, and aligning their existing programs, maximizing parental choice, building on success of existing programs, and fostering partnerships. All of these activities that are designed to improve early childhood care and education systems also improve mixed delivery options. There are many benefits to mixed delivery systems. Today, we're going to focus on one, increasing family choice. This is not only an important benefit of mixed delivery systems, but a priority of the PDG B5 initiative, the presidential administration, and a significant challenge impacting many families and communities across our state. Probably many of us here today on the phone or on the webinar. It's a very relatable and important challenge that can be addressed through mixed delivery. So this picture over here is one that I found online that I sort of thought represented a nice graphic of what it's like for families to interact with the early childhood care and education system. The system is often fragmented and difficult for families to navigate. There are multiple eligibility requirements, program characteristics, variables to consider such as slots available, time of day that the programs are open. And then in addition to this, add to the complexity that at least 98% of families with children under 5 live in communities where there's not enough access to meet the demand or need. And that data is from before the COVID pandemic. So we can likely assume that the pandemic did not improve the statistic. So delivering services through a combination of programs can make the process easier for families and increase their access to high quality programs. So as I mentioned, we're gonna talk definitions and then provide an example. So our first example today comes from Nikki Coben, who is the Director of Early Learning Services at the Minnesota Department of Education. And she's gonna share some work Minnesota has done that captures the experiences of families accessing early care and education. So go ahead, Nikki.
Everyone, really happy to be here with all of you today. I will say that I am subbing in, so I apologize for someone who's out sick today. So I apologize if I stumble a little bit, but hopefully we'll get through this together. As was just said, as the Director of Early Learning Services at the Minnesota Department of Education, this division oversees our early childhood special education programs, our public pre-K, our early childhood screening, and early childhood family education. So I just wanted to start off with that a little bit. Next slide. So we in Minnesota really wanted to better understand from families and providers directly what barriers they were experiencing to accessing early learning programs. And we had an opportunity to partner with a sprint team from the New America Foundation and some advisors from the Build initiative as well to gather that input and to do some stakeholder interviews. And so we were really excited to take advantage of that. Next slide. Excuse me. Minnesota is home to over 350,000 children under the age of 4. And we offer numerous pre-kindergarten programs to help families prepare their children for school. And yet the system is really difficult for families to navigate and access. We had a recent report from the Office of the State Legislator Auditor that found that these services are complex and fragmented. The report examined 9 Minnesota early learning programs, early childhood programs overseen by the Minnesota Department of Education, the Department of Human Services, as well as the Minnesota Department of Health, and found that the programs differ in their eligibility, how the state funds them, and other requirements. And that complexity creates difficulties for families and providers. I'm sure this is a familiar story. I don't think Minnesota is unique in this, but it leaves families and program administrators frustrated, and families really struggle to figure out what school readiness programs they're eligible for, what programs will serve their children's needs best, and how to enroll in these programs. So during the course of 3 months, the New Practice Lab did a design sprint in partnership with us to identify tangible ways for all of us to reduce the complexity and fragmentation. We really focused on early learning, but as I'm sure you all know, the early learning programs that we oversee, as I'm sure is familiar with all of you, families don't think of us in silos, so they often were talking to us about programs that were overseen by the Department of Human Services, our child care, Parent Aware rated programs. Parent Aware is Minnesota's quality rating and improvement system. So we heard from everyone about sort of all programs. And in our next slide, we're gonna actually play some audio clips of the interview. So we can move to the next slide and start that audio.
That's why I like the program, because it's not just for the children, but for us as a parent. And me, I will say, is what I learned English is from the program, because they give me the opportunity to go to take English classes. They provide us transportation, which is just amazing, because some of us don't have a car, or we struggle finding who will ride us to the school. And yeah, that's awesome. I love the program for that reason.
communication with our teachers. They're always in constant communication via text, whether they're calling about them being heard at school or whatever it is that they're having fun about that day. They're always calling and letting us know what's going on.
I guess I didn't really have any challenges, to be honest with you. Getting my daughter into the program, it was really kind of easy.
I really want them to see how difficult it is to do these things, how hard it is to put out that kind of money when you don't have it, how hard it is to even get into child care funding. I mean, for everyone, it's so hard of a process if you don't have the right access, or you don't do something right, or if you even miss a step. All of that goes away and you have to restart the whole process. It's like, I really want them to understand how difficult it is to do this.
Already told us about the scholarship, so we have to dig in from other community members, and they told us, there's a program so you can apply.
I said, I feel like I was able to get the child care assistance and get the help to be able, like, when I wasn't working. So, okay, I'm not working. You guys want me to do job searches and to be able to keep him in daycare. But once I start working, it's like, okay, now you guys aren't helping. And so I pretty much have to either put all my work to pay daycare or quit the job and stay home with the kids, or be able to send them back because now you guys are going to help again that I'm not working.
It hurts so bad because at sometimes you feel like, well, how do I win if the whole system is against me? And at another time, you're like, well, I got to go strong. I can't stop now. I have to. I'm more than just my skin color, and it just hurts.
Maybe if these schools and programs started creating incentives for families that are together, just like they create incentives for women that are single, I believe that might be the only way to actually start the process and the conversation on families staying together. Because right now, the way things are set up, it creates a dialogue on why we should separate.
It's ominous. The diagnosis is already ominous. If I could make it, if I could wave a magic wand, make it swallowable. And by that, I mean, give me like 3 steps to follow first off. Give me 5 steps to follow first off. Let me build from there, because this journey is a continuous journey. It's going to start by the smallest steps you learn. But if you give up on the first 3 steps, that journey is never going to get any bigger.
I'm really not sure how it all works. I get so confused. There's so many ins and outs of stuff, and it gets to a point where you just give up.
So I saw a comment, the approach to hearing family stories, and that was so important to us, is to really hear from families directly, to capture their stories, to take those direct quotes from them and not try and do too much interpretation of what they mean or what they're saying, but really just sort of take it in. And so they were able to talk to 42 families, and 28 of the 42 families we spoke with primarily spoke languages other than English, and 22 reported facing language barriers when trying to access preschool programs. About half of them reported cultural barriers, a little bit more than a third reported process barriers, and majority of parents reported that they found programs by word of mouth. So they heard from friends, family, churches, and local organizations. And so, next slide. What we also created from these interviews were these journey maps, which we have a handful of them. This is an example, and it really walks us through sort of what families experience as they're moving through our system, the good, the bad. I think many of those early quotes that we heard from those families directly that talked about the programs themselves, talk about the benefit that they experience and the real value that they find when they get connected to programs that meet their needs. And so most of what we heard was about the difficulty in accessing it and navigating it and paying for it, and the sort of problems that people or that families experience when their income goes up slightly. And so this journey map sort of shows an example of a father who had that same experience of their income just being slightly above the limit. But eventually convincing a program to take his child and the real benefit that he experiences and the positivity once he's connected to a program. Next slide. So I think some of the biggest things that the sort of barriers that we heard was that there's no single online source of truth for families who are looking for programs. If they want to find a school-based program, they have to look in the school district. If they're looking for childcare programs, they can go to our Parent Aware site. Our school-based programs are getting put on there, but it's not an integrated system, and I don't know how well families are finding it, I guess. And then in addition, there was a lot of, we heard a lot about the separate applications to be considered for different programs, even though they're similar. So the duplication and having to fill out multiple applications when they want to access services, early learning, early care and education services for their children. Next slide. The other major thing that we heard about or that we sort of identified through interviews with the state agency stakeholders and providers too, were really on the program or on the data system side, I guess, which is that we don't have waitlist data. It's maintained locally. They don't necessarily capture the cultural and linguistic diversity data that we would need so we can target outreach. And so a bunch of challenges around that, especially for English language learners. Next slide. So the recommendations that came out of this report and these stakeholder interviews with families and providers and state agency staff were really focused, I think, broadly on two groupings. Some focused on the sort of programs, right? Deliver family-centered services, but most of them focused on the state system surrounding early care and education programming. So have a single website for families with young children, work on data sharing across programs and agencies so that we're able to redirect families that don't qualify for one program to the programs they do qualify for, collect more meaningful whole family data, including on language, home language and things like that, so we're better able to target services, increase capacity at the agency level for human-centered design, using any demographic data we have to target services and bringing more diverse staff at our state agency level on board. And so I'll sort of conclude with saying we found this to be a really valuable experience, this engaging with people with lived experience, hearing what they want, what they need, what they're experiencing. And I think creating a more comprehensive system to really help families navigate. We certainly have access issues. We also have issues in Minnesota with there being enough slots for kids and families, but I think the biggest challenge is them navigating and finding what fits best for them and their children. So thank you very much, and look forward to hearing the other presentation and answering questions.
Thank you so much. You did a great job as a fill-in. We were glad to have you. So we'll have a chance. You can put questions in the chat. I think Nikki, it sounds like she can do the chat. Otherwise, there should be time at the end for discussion and questions specifically for the presenters. And so I think Nikki really set the stage. I really was excited to have them share the audio clip and the journey map. The first time I saw those two pieces of information, it just brings home the idea around family choice and why it is such an important and significant topic, and how at the state level, state administrators, program administrators can help find solutions and strengthen the state system in real ways that really support families. So next I'm going to dig into collecting data on mixed delivery systems to increase family choice. So not necessarily everyone's favorite topic, but the data is so important to helping parents know what's there, helping the state know how to serve families. And you'll see in the brief that it sounds like there was some issues getting access to, but Howard was able to put the PDF in the chat. We outlined two important questions to consider as a state level administrator. when thinking about mixed delivery and choices for families is to first think about, are there options for families to make choices when selecting early care and education programs in their communities? Do some of your rural areas only have one big childcare center or one Head Start offering? Or do you live in a place where there's 5 or 6 different choices of kinds of programs available for families? And if there are choices available for families, are they the right choices? So do they meet families' needs? Do they meet families' priorities? Are they the choices that families want to pick from? Answering these questions and thinking about these questions will do a couple of things for state level folks. It will help you document your current mixed delivery system. It will help inform plans to enhance and improve your mixed delivery system. You'll be able to look for gaps and places to put plans in place to strengthen the system, and you'll be able to measure success because you'll have a baseline level already documented. So I suggest, or we suggest in the paper, and I put it on the slide here, a really simple table to take stock of your system. Think about what programs are being funded by federal and local sources. Where are those programs? Who is your contact at those places? And are there any existing coordination and alignment efforts? Do you have a regular quarterly meeting with that program? Do you share each other's newsletters? This will help you create a big picture and take stock of all of the programs in your system that help support kids and families who are birth to 5. So once you've taken stock of your programs, you could use this chart to really quickly, I mean, it's very simple, right? Identify any programs where you don't see any sort of coordination and alignment. Find a program where you think the coordination and alignment is sort of weak and think about ways you can strengthen it. Find some really high quality coordination and alignment so that you can use that as an example for moving forward. So just a really simple activity like this can get you started thinking about mixed delivery and choices for families. But beyond that, it's also important to have the right choices for your families. So I often share my personal story of finding childcare for my kids. I was working at the state. I had full knowledge of the quality rating and improvement system, and I chose a 3-star program for my kids because it was in my community and it was close to my house and they didn't have a wait list. And so there's more to selecting childcare than one, and placement options than one single piece of information. And so we created a list of what we thought of as some basic options that states could collect information on to help parents make these choices. This is certainly not a comprehensive list. There is probably variables that are unique to different communities that would be important for you if you had a community like that in your state. But thinking about where the program is located, is it in a center? Is it in a home? Do they operate all day? Is it 24-hour care? Do they operate just during working hours? Is it a program targeted for the school year and not for summer? Or are they only open in the summer? So you can see the list here. I don't need to walk through each one for you today, but we also know that this information can be really difficult to collect and difficult to capture within current state administrative data systems. So after you have looked at your big comprehensive picture and taken stock of your system, the next thing you want to do is think about what data you do collect, what data you do have, how you could share that data with families in your system as it stands, and then make plans for how to collect more of the information that would be useful to families as opportunities arise. Similar to that previous list, this is not an all-encompassing list of places that states share information with families, but here are 3 ways that states commonly share information. So childcare.gov is a requirement of the CCDF fund, and all states have consumer education websites, and you can go to childcare.gov and get access to each state's consumer education website, which will include lots of information on the programs in that childcare programs in that state. There are some states who have created early childhood integrated data systems, or ECIDSs, that target family choice and parent knowledge as an important use case. So they're collecting and creating integrated data that will help inform parents about choices for programs. There are also a number of states working on eligibility and enrollment portals. This allows families and parents ways to complete some of those complicated applications at times and locations that are best for them. They can usually be accessed on your phone. They're available 24 hours a day. So instead of trying to navigate your way to an office, for example, during a regular business hours, you could submit your application to a number of different programs via your phone or online. And so now I want to introduce Erin Gronetsky from the Wisconsin Department of Children and Families. She is going to show us and demonstrate how Wisconsin collects and shares some of this data with families.
Awesome. Thank you so much, Mandy. My name is Erin Gronetsky, and I work at the Wisconsin Department of Children and Families within the Division of Early Care and Education. And in Wisconsin, in our division, we house our licensing, our regulation for childcare programs. We house our childcare subsidy system, and we house our quality system. So our QRIS, our Teach Scholarship Reward Stipend programs, our Childcare Resource and Referral Network, and then a couple of other training projects throughout the state. I specifically work in the quality area, but work closely with those other sections as well. Go ahead and go to the next slide, please, Mandy. Okay, so we had to build a consumer website, as was discussed in the previous slide. And our original site is called the Child Care Finder site. And it really just had baseline information that was required. So we had all regulated, which meant licensed programs across the state. They were either the early child care or our school age care programs as well. And we had the regulation history for the past 3 years. We had their QRIS rating, our star rating system, as well as some reporting on how they did within the QRIS on the specific indicators that we have. And then general information about their contact information, address, their hours, phone number, things like that. Within that Child Care Finder site, we have a search feature where folks could search by address, by location, by name of program, by star rating, and things like that. And then we also have a map feature where it will show a variety of programs within a particular area that you might be looking for. Go ahead and go to the next slide. So we wanted to improve our consumer education site. It was while we were developing our preschool development grant, and just generally wanted to do some improvements. We started looking at our childcare resource and referral reports that come into us quarterly. And they provide us with a lot of data on what families are saying, what families are looking for, the struggles that families are having. And we saw that repeatedly over and over again on these quarterly reports, there was a need for infant toddler care. Around 40% of our referrals were for children under the age of 12 months. That's very common. I'm sure it happens in your state or locale as well. But infant toddler care is something that families were looking for. They were also looking for care during non-traditional hours. About 20% of our all referrals were looking for either overnight, evening, or weekend care. We had families that really were trying to find programs that served multilingual families and children, either offering programs in different languages other than English, or offering programming in both English and a language other than English. And then finally, we heard from families that were struggling to find appropriate programs or programs that fit their need when they had children with disabilities. Additionally, we were looking at our preschool development grant and looking at different systems. So we knew a lot about the regulated childcare programs in our state, but the Head Start and Early Head Start and 4K systems were housed in a different department. So we knew very little about where those programs were located, and they were not included on our Childcare Finder site at the time. And we really wanted families to be able to see those programs in addition to the regulated programs, so they could have all of their choices available on the one Childcare Finder site. And then the third thing that we had just completed at the time was a suspension expulsion study. And what we found was that, like many states, we had some suspension expulsion issues within early care and education programs, particularly for programs that served children of color and particularly boys of color. And so we really wanted to find a way to support families and providers around suspension expulsion. Next slide, Mandy. Great. So we had some challenges. There was no existing tracking of Head Start, Early Head Start, or 4K sites. They were housed in a different department, in our Department of Public Instruction, but they actually didn't have a list of all of these programs for us to kind of just take and share data. So we didn't have any sort of data source at all that provided that information. Our regulated programs in our quality rating and improvement system, some of them did have collaborations with Head Start, Early Head Start, and 4K, and they did report those collaborations, but we didn't know outside of those collaborations where those sites were located. So what we did was we started to collect annual Head Start and Early Head Start site information, and we went directly to the Office of Head Start. When we had all of those programs, we started creating those lists, the list of all of the programs, their site location, basically the same type of information that we had on regulated programs. We also were able to move the Head Start state collaboration position from the Department of Public Instruction to our department, which made it a lot easier to then start building on that list of locations that we had. And then we started to survey all of our regulated programs to determine whether or not they had collaborations with local school districts, whether or not they had a collaborative 4K site. And once we had done all of that, we were able to come up with a larger list of programs where we had identified all Head Start, all Early Head Start programs, as well as all collaborative 4K childcare programs in the state. Great. What we did have from our regulation database was information about programs that were regulated to serve infant toddler care. We did have information about programs that were regulated during non-traditional hours, which we defined as between 6 p.m. and 5 a.m. And we had information about programs that were regulated for weekend care. We also started inputting into our quality rating improvement system information about Head Start and Early Head Start site information. And then again, we included that collaborative data around 4K Head Start or Early Head Start that we had collected from surveys as well as from the Office of Head Start. We could go ahead and move on to the next. And then from all of that information, because the data was now housed in our system, we were able to display this information on our childcare finder. So we added lovely little visuals and search capabilities for some of these features that families were looking for. So there was infant care, 4K programming, Head Start and early Head Start programming, nighttime care, weekend care, and there's also evening care as well. And so families were able to go ahead and search by these features instead of just, I want to see what is available in my county, or what is available in my city, or what is available at a 3-star or 4-star level. I can also now see what providers in my county have infant toddler care and Head Start care. Or what programs in my county have nighttime care. Go ahead and go on to the next one. And so those are already embedded within our system for families to use right now. And as we continue to